On today's video, I'm going to give you 10 sets of board exam type of questions that could possibly come out on the upcoming 2025 nursing licensure examinations. If you want to know more about that, stay tuned. How are you guys doing wherever you are right now, whatever time zone you're watching me right now? Just wish you good morning, good afternoon, and good night, just in case I don't get to see you. Now, like you're seeing on the title, yes, today is all about your another entry natin sa ating nursing test banking videos, where I give you possible board exam type of questions that will come out on the next board exam. Now, these 10 sets of questions are the previous questions that come out from the last board exam or couple of years ago. So you might want to take this as a reference. Now, if you haven't watched the other nursing test banking videos I created on my channel, I'll be putting the link on the description box, or whenever the icon button pops out, click that one out because I'll be linking it there together with the other playlist I have on my channel. Now, these sets of questions are your preparation for the upcoming May 5 and May 6, 2025 nursing licensure examination in the Philippines. There's also another one that's going to be scheduled on November 4 and November 5. So, you might as well go ahead and start your preparation. I know that all of you guys, all of the nursing students, this is your era, your moment of like preparing. Trust me, I know what I'm talking about because I've been there, been done that. Now, whenever you're taking my nursing test banking videos, I want you to really like imagine as if you are in that day that you're sitting down and taking your board exam. Imagine if this is the last questions of the board exam, how well do you want to perform? Now, I want you to get a piece of paper, write your answers on a sheet of paper, because at the end of each question, I'm going to reveal the answer together with the rationalization. If there's anything that I want you to take out from this video, that is actually the rationalization, because these questions are previous questions from the board exam, like I said earlier. I want you to familiarize yourself on how they are going to structure the board exam questions and how are you going to attack. Trace keywords. How are you going to really understand what is the question asking from you? Because we have this tricky questions. Now, I want to take note of how I approach certain questions in order for you to apply that to your practice. You guys ready? Let me read to you the instructions for today's exam. You'll be given 10 board exam type of questions. So I'll be reading the questions and the choices for you. You have 5 seconds to answer each questions. The answer is revealed instantly after each question with rationalization. Choose the letter of the correct answer. Good luck, nurses. Board exam type of question number 1. The nurse in charge in labor and delivery unit administer a dose of terbutaline to a client without checking the client's pulse. The standard that would be used to determine if the nurse was negligent. The question is giving you the scenario where the nurse is about to administer terbutaline to a patient. Which of this is actually an act that shows or a proof that the nurse committed negligence? All right, so that is the question. That's how are you going to dissect it. Let me give you the choices. A, the physician's orders. B, the action of the clinical nurse specialist who is recognized expert in the field. C, the statement in the drug literature about administration of terbutaline. Or D, the actions of a reasonably prudent nurse with similar education and experience. Your 5 seconds starts now. Time is up, you guys. What is the answer? The answer is letter D. The actions of reasonably prudent nurse with similar education and experience. The standard of care is determined by the average degree of skill, care, and diligence by the nurse in similar circumstances. Hence, the answer is letter D. Let's proceed. Nurse Trish is caring for a female client with a history of GI bleeding, sickle cell disease, and a platelet count of 22,000 units. The female client is dehydrated and receiving dextrose 5% in half-normal saline solution at a rate of 150 ml per hour. The client complains of severe bone pain and is scheduled to receive a dose of morphine sulfate. In administering medication, Nurse Trish should avoid which route of administration? Now, here's our going to dissect. this type of question. I want you to underline morphine, and I want you to underline some of the current history of present illness of the patient. Platelet count, severe pain, abdominal pain, sickle cell. And I want you to underline or encircle route, because those are the key terms that will tell you what is the question is trying to ask or get from you. The question is really asking you, how are you going to administer morphine sulfate? The best route of administration for morphine sulfate in a patient with having sickle cell, platelet count of 22,000, so on and so forth, as you see on the question. Now let me give you the choices. Is it A, IV? Is it B, IM? Is it C, oral? Or D, SC? Your 5 seconds starts now. Time is up, you guys. The answer is letter B, IM. With a platelet count of 22,000 units, the client tends to bleed easily. Risk for bleeding. Therefore, the nurse should avoid the use of IM route because the area is highly vascular and can bleed readily when penetrated by the needle. When penetrated by the needle, the bleeding can be difficult to stop. Kasi nga naman, because what is the scenario telling you? There's already like low platelet count. So any puncture, any form of penetration, any form of needle prick, it could be hard to produce clotting process or clotting factor. Hence, the answer to that is IM. Question number 3. Dr. Garcia writes the following order for the client who has been recently admitted. Now, digoxin 125 milligram once daily to prevent a dosage error. How should the nurse document this order onto the medication administration record? Nurses, listen, before I give you the choices, the question is asking you the proper documentation of your digoxin 125 milligram per ORM, OD. How are you going to document that to prevent any medication error? That is the question. Is it A, digoxin 1,250 milligram per ORM once daily? Is it B, digoxin 0.1250 milligrams per ORM once daily? Is it C, digoxin 0.125 milligrams per ORM once daily? Or D, digoxin 0.125 milligrams per ORM once daily? Your 5 seconds starts now. Time is up, you guys. What is your answer? The answer to this question is letter C, digoxin 0.125 milligrams per ORM once daily. Now, the nurse should always place a 0 before a decimal point so that no one misreads the figure, which could result in dosage error. The nurse should never insert a 0 at the end of the dosage that includes a decimal point because this could be misread, possibly leading to a 10-fold increase in the dosage. Now, nurses, just to give you an idea, in the real world, in real practice, once you already passed the board exam, documentation error and medication error, these examples are actually happening in real life. So, apart from preparation for your nursing board exam, I want you to be really mindful and start doing it right because it will become a habit for you. You know what I mean? Of course. Very good. Now let's proceed to board exam type of question number 4. A newly admitted female client was diagnosed with deep vein thrombosis. Now this is the concept of your DVT. Let me just give you an overview, or let me just give you a tip. I actually created like a lecture regarding a thorough and comprehensive study of your DVT together with the other MS topics that we have. I'll be putting the link on the description box, or whenever this icon button pops out, click that one out. I believe the playlist title is medical surgical nursing. I kind of like went into deep dive of this topic, okay? Now, which nursing diagnosis should receive the highest priority? Very simple questions. Don't make it complicated. The question is asking you about the concept of DVT. Now, it also asking you how are you going to prioritize or apply your nursing prioritization skills in the concept of DVT. Remember when you're talking about prioritization, nursing prioritization, how are you going to go about it? ABC, followed by your ADPI, and then your Maslow's hierarchy of needs. Remember? Very good. Now, let's apply that. Is it A, ineffective peripheral tissue perfusion related to venous congestion? Is it B, Risk for injury related to edema. C. Excess fluid volume related to peripheral vascular disease. Or D. Impaired gas exchange related to increased blood flow. Your 5 seconds starts now. Time is up, you guys. The answer to this one is letter A. Ineffective peripheral tissue perfusion related to venous congestion. Ineffective peripheral tissue perfusion related to venous congestion takes the highest priority because venous inflammation and clot formation impede blood flow in a client with deep vein thrombosis. Now, remember our nursing prioritization ABC: circulation, deep vein thrombosis, right? Very good. Let's proceed. Now, we're almost halfway through. This is board exam type of question number 5. Nurse Betty is assigned to the following clients. The client that the nurse would see first after endorsement. Now, let me just pause for a minute. This question is also asking you for prioritization. Here's how you're going to dissect it. Let's say it's the start of your shift. Among the 4 patients that you have, which one of these were you going to see first, based on their background, based on their current chief complaint? That's how you're going to prioritize it. Of course, applying your ABC, applying your ADPI, and also applying your Maslow's hierarchy. Let's go. Let me give you the choices. Is it A 34-year-old post-operative appendectomy client of 5 hours who is complaining of pain? Is it B, a 44-year-old myocardial infarction or MI client who is complaining of nausea? Or is it C, a 26-year-old client admitted for dehydration whose intravenous or IV has infiltrated? Or is it D, a 63-year-old post-operative abdominal hysterectomy client of 3 days whose incisional dressing is saturated with serosanguinous fluid? Your 5 seconds starts now. This is pretty basic, you guys. The answer is you guys ready? The answer is letter B. A 44-year-old myocardial infarction client who is complaining of nausea. Now, listeners, nausea is a symptom of impending myocardial infarction and should be assessed immediately so that the treatment can be instituted and further damage to the heart is avoided. The thing about MI, you guys, I actually created also like a thorough study about MI. Timing is everything. You have to act immediately as soon as you identify that this patient is suspected of MI. As long as it's not proven as MI, then you have to start the treatment. All right, now let's proceed. Board exam type of question number 6. Nurse Gail places a client in a 4-point restraint following orders from the physician. Nurses, this is the concept of your restraint application. On the right of the bat, the question is really asking you about restraint. I want you to underline that for me, please. Thank you. Now, the client care plan should include, this is the question. How are you going to make a care plan for a patient who is on restraint? That is the question. These are the choices. Is it A, assess temperature frequently? Is it B, provide diversional activities? C, check circulation every 15 to 30 minutes? Or D, socialize with other patients once a shift? Socializing. The answer to this question, you guys, is letter C. Check circulation every 15 to 30 minutes. Restraints encircle the limbs, which place the client at risk for circulation being restricted to the distal areas of the extremities. Checking the client's circulation every 15 to 30 minutes will allow the nurse to adjust the restraints before injury from the decreased blood flow occurs. Remember, whenever you apply restraint to the patients, you will put it here. There's different types of restraints, but when it's like a 4-point restraint, normally we put it here on the limbs, hands, right and left, and on the limbs, right and left, and then we attach it to the bed. That restraint, constant pulling of the patient can impede the blood circulation on that area. So you want to go ahead and check it 15 to 30 minutes. And this is very true because whenever you are in the field, you will notice that whenever you have the restraint order, especially when the patient is advisable or is indicated for restraint. The things that you have to check is, of course, restraint orders should be renewed every 24 hours, and also constant checking of restraints, meaning there's actually a template, or it depends on your hospital SOP. There's a template where you're going to fill it out hourly. Well, that was based from my experience, okay? Now, I believe last 4 questions. Make this one count. A male client who has severe burns is receiving H2 receptor antagonist therapy. What's H2 receptor antagonist therapy? Alam mo na yan. Now, the nurse in charge knows the purpose of this therapy is to. Now, what is the indication of H2 receptor antagonist therapy? That is the question. All right. Is it A, prevent stress ulcer? Is it B, block prostaglandin synthesis? Is it C, facilitate protein synthesis? Or D, enhance gas exchange? Your 5 seconds starts now. The answer is letter A, to prevent stress ulcer. Curling's ulcer occurs as generalized stress response in burn patients. This results in decreased production of mucus and increased secretion of gastric acid. Now, the best treatment for this prophylactic use of antacid and H2 receptor blockers. Hence, we give antacids or PUD, prophylactic ulcer drug. Last 3 questions, you guys. How was your score so far? I hope you guys are getting it. By the way, at the end of this topic, at the end of this video, I want you to put your scores down below. I want to see how effective my teachings are. All right? Now, let's proceed. Board exam type of question number 8. The doctor orders hourly urine output measurement for a post-operative male client. The nurse Trish records the following amounts of output for 2 consecutive hours. See this. 8 a.m., you got 50 ml of urine. 9 a.m., you got 60 ml of urine. Now, nurse says, based on these amounts, which action should the nurse take? Now, let me pause for a while. Based on the measurement on an hourly basis of your urine output, what does the values telling you? That's just it. And how are you going to respond accordingly? Is it A, increase the IV fluid infusion rate? Is it B, irrigate the indwelling urinary catheter? Automatically, letter B is not the right answer. Okay? I'll tell you why later. Is it C, notify the physician? Or D, continue to monitor and record hourly urine output? Go. Time is up, you guys. Now, let's try to dissect the choices. Process of elimination. First one, you're not going to increase the IV fluid infusion. In the question, it's not even written there if the patient is receiving IV therapy or is on ongoing IV therapy. Automatically, cross out. Do not anticipate, do not assume that the patient is on IV therapy if the question in the scenario is not really telling you that the patient is on IV infusion. That also apply to letter B, irrigate indwelling urinary catheter. It doesn't say anything about FC or Foley's catheter. So why would you answer Foley's catheter? Now that leaves you with choices C and D. Are you going to notify the physician? Why were you going to notify the physician? Is there any deviation from normal? That's how are you going to think through it. Now, D, continue to monitor and record hourly urine output. Now, the answer to this is letter D. You know why? Because normal urine output for an adult is approximately 1 ml per minute or 60 ml per hour. Therefore, this client's output is normal. Beyond continued evaluation, no nursing action is warranted. Basically, you just have to know about your normal values. It really helps a lot when you are going to memorize your normal values. Sometimes the question is a bit tricky. You might think that there's something wrong. Like if you're gonna really look at it, there's something wrong with this patient. I need to do something. No, sometimes the question is really testing your knowledge when it comes to normal values, basic concept. All right, so watch out. Last 2 questions, make this one count. Question number 9. Tony, a basketball player, twists his right ankle while playing on the court and seeks care for ankle pain and swelling. After the nurse applies ice to the ankle for 30 minutes, which statement by Tony suggests that ice application has been effective? First of all, I want you to go back to your concept of cold temperature towards vasoconstriction. What does it do? Hot temperature, what does it do to the blood vessels? Vasoconstrict, vasodilate. That's how you're going to attack it. Use your imagination. Now, let me read to you the choices. My ankle looks less swollen now. Is it B, my ankle feels warm? Is it C, my ankle appears redder now? Or D, I need something stronger for pain relief? Effectivity of nursing care intervention. Time is up, you guys. Now, the question is asking you, after you applied cold compress to the ankle, how would you measure the effectivity of that nursing intervention? The answer is letter A. My ankle looks swollen now. Ice application decreases pain and swelling. Continued or increased pain, redness, and increased warmth are signs of inflammation. That shouldn't occur after ice application. Board exam type of question number 10. The physician prescribes a loop diuretic for a client. When administering this drug, the nurse anticipates that the client may develop which electrolyte imbalance? Nurses, question is asking you about what electrolyte imbalance would you expect for a patient who is receiving loop diuretic? That is the question. Is it A, hypernatremia? Is it B, hyperkalemia? Is it C, hypokalemia? Or D, hypervolemia? Your 5 seconds starts now. Time is up, you guys. The answer to this one is letter B, hyperkalemia. A loop diuretic removes water and along with it, sodium and potassium. Guys, remember the concept of wherever sodium goes, water follows? Same thing. Now, this may result in hyperkalemia, hypovolemia, and hyponatremia. Thank you for watching. If you found this video enjoyable, please consider liking and sharing it. Feel free to comment below with any questions or suggestions. Your ideas may inspire our next video. Don't forget to subscribe and enable notification bell to receive updates on my future uploads. You can find all my social media links in the description box below. Please explore them. Once again, this is NurseBrain, inspiring greatness one lesson at a time.